Okay, so this is my newborn assessment. I unfortunately don't have a baby doll, so I'm going to be using Red Panda. So first thing you do is check that you have the right patient on their little armband. It might be on their leg, actually. You're going to start with your vitals, so respiratory rate, making sure that they're breathing bilaterally. You're going to be listening to all the heart sounds, so I'm not going to put my stethoscope on, but you're going to be listening to like herbs, mitral, pulmonic, aortic, all that, and then you want to do like temperature last. After that, you're going to be inspecting like the head. So for molding, is there any like swelling? Is there abrasions? You know, consider if they used forceps or like the vacuum, that type of thing. Checking the fontanelles, the anterior should be diamond and flat. The posterior should be triangular and also flat. The sutures, okay, so there's 6 cranial bones. They need to be symmetric. I know there was a video I watched where they said they could be overlapping a little bit. That's fine. So after you're done with the head, you need to make sure you put the little baby hat back on because you don't want them to get cold. So now you're going to be moving on to the face. It's a little hard with this guy, but so you're going to be looking that the eyes are symmetric, that the nose is symmetric. I already said about the nasal flaring, but you don't want the nostrils to be flaring. Check for drainage in the nose and in the eyes, for milia on the nose that it's normal. You should compress the nose to check for jaundice. You should check the eyes and the skin for jaundice. The sclera should be white, and the conjunctiva should be just, you know, it's normal pink mucosal. And no eye swelling, because sometimes, like, if they can have like the eyelid swelling. I couldn't think of the term, but eyelid swelling. You want to make sure they don't have eyelid swelling. You also want to check that their ears are, you know, symmetric, that there's no pitting. You want to check the lips, that they're just like normal and pink. They're not too cracked or anything like that. Like cleft palate, you're looking for the cleft palate too. Here at this point you would kind of, make sure you have gloves on, by the way, stick your finger in the baby's mouth for the sucking reflex, and you should also be palpating the soft and the hard palate. Check that, like, if they start crying, that they don't have like the tongue tie, that they don't have like those Epstein pearls, which is like the white dots. You should also do the rooting reflex, so, you know, kind of on the cheek, make sure that they come around and like have that sucking reflex again. I think I already mentioned mucous membranes, that they should be pink. So now you're kind of moving on to like the neck and the chest. So you're checking the clavicles, that there's no crepitations or like popping or bubbles or anything like that. You need to palpate the neck. You might need to move it around a little bit just to be able to do so, but that's okay. You want to check that they have good range of motion, that they can turn their head. My stuffed animal can't really turn its head, but we're gonna, you know, kind of try. Does it have good neck support? And kind of doing that tonic neck reflex, so turning head to one side and the arm moving with it for both sides. So after that, you're going to be kind of looking at the skin. Do they have Mongolian spots, which are normal? It's just like the pigmentation hasn't come out yet. It's kind of like bruising. Do they have like that strawberry on their face? Do they have any port wine stains? Do they have acrocyanosis, which is kind of normal in newborns to have some bluish tint to like the extremities? Do they have lanugo? Do they have stork bites? That kind of thing. So now for the chest, you need to make sure that like the nipples are symmetric. You're looking at the chest muscles. Here you're listening to breath sounds front and back. So again, you know, pulling out your stethoscope, you're listening to all breath sounds. I think the video that we used says it helps it doesn't matter if they're crying, because then you can kind of like hear it even better if they are crying. But like when you listen to the heart sounds, if they are crying, make sure you kind of have like your finger in their mouth so that you can hear the heart sounds better. But it's okay if they're crying for the breath sounds. You're also checking the xiphoid process. So now you're on hands and arms. So you're checking the pulse sites, the brachial pulse sites. You're checking range of motion. Can they grasp, like if you put your finger in their palms, are they grasping for that grasping reflex? Check that they have 10 fingers, 5 on each hand. Do they have creases in the palms? They should have at least like those 2 creases. Only one is like a sign of Down syndrome, I think. The startle reflex is when you like hold the arms up and then you let them go, and the baby should kind of like catch their arms from falling. And then you do like the Maro reflex, which is like you're holding the baby and you kind of just like let the baby feel like it's falling, and their arms should like go out kind of almost as if they're gonna like catch themselves. Also, while you're doing this, you should kind of check for their neck support. Can they support their neck as you hold them like this? Now you're moving on to the abdomen. So you might need to like hold the legs up kind of if their abdomen is really, if they're not relaxing. This will help them relax. So their abdomen, their stomach, it might be protruding a little bit. That's okay. Their abdomen might be moving with their breath, which they should, because babies are still using the abdominal support to breathe. You want to listen to bowel sounds. Always start in that lower right, kind of move around into the 4 quadrants as you're listening. Checking the skin color of the abdomen for any skin abnormalities, like we said earlier. Do they have some like acne of the skin? That's pretty normal. So after you do that, you should look for the cord. Is there any drainage? Drainage is not a good sign. It should be dry. It should be clamped. And you want to feel if the liver is palpable, which it should not be. Next, you want to move on to genital inspection. So if it's a girl, they might have some swelling, they might have some edema. That's normal, but not a whole lot. A little bit is normal. They should have separation of the labia. There may be some mucus or vernix. For males, you want to check that there is 2 testicles, that they have dropped, and circumcision. If they have had a circumcision, you should be checking the circumcision site. Also, at this point, you want to be checking the anus as well. So they should not have like that tuft of hair, like a lot of hair around on like their backside here. And they shouldn't have like that sacral dimple. So at that point, you're also checking the spine, that it's like straight and it's flat and even and goes down like that. Then you want to check the hips and the legs for range of motions, so doing the Barlow maneuver. So legs, going up kind of like this and then out, and checking that they are able to do that with no like crepitations or pain or tenderness, I guess, that you're feeling. You should also check that they have good good muscle tone. So you want to do like the step reflex. So when you kind of like put them down and kind of like on their feet almost, like they aren't gonna be able to walk obviously, but they should kind of have that step reflex like they're going to. You should check their feet and their toes, make sure they have the 10 toes, 5 on each, same as hand. Check for creases of the feet. You should check the folds of the back of the legs as well. And you should do the Babinski reflex. So kind of, putting your fingers on their feet here and checking that their toes are like spreading out and away. And you should also do the plantar grasp. So it's kind of like they're grabbing your finger like they would with your hand. And that's pretty much it for my assessment of the newborn.